Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Shortness of breath. There are a few sensations as frightening as not being able to get enough air. Shortness of breath, also called dyspnea, is often described as an inability to get enough air into the lungs, a tightening of the chest, or a feeling of suffocation. Strenuous exercise, extreme temperatures, massive obesity, and high altitude can cause shortness of breath in a healthy person. Otherwise, shortness of breath is likely a sign of a medical problem, particularly if it comes on suddenly. If you have unexplained shortness of breath, especially if it comes on suddenly and is severe, see your doctor, attend an emergency room, or call emergency services for help as soon as possible. The primary causes of shortness of breath seen in the primary care physician's office are diseases of the lungs, airflow obstruction from asthma and chronic obstructive pulmonary disease make up a significant amount of the lung disease seen in the physician's office. Heart disease. Heart disease presents with shortness of breath because the heart cannot work hard enough to meet the demands of the body. Usually these patients will have a history of high blood pressure, cardiac ischemia, or valvular heart disease, and obesity. There are a number of other disorders that can also cause shortness of breath and must be considered by the physician. Pulmonary embolism. When a blood clot gets caught in one of the arteries that go from the heart to the lungs, it's called a pulmonary embolism, a PE. Pulmonary embolisms usually travel to the lungs from a deep vein in the legs. Dissecting aneurysms. A dissecting aneurysm is an aneurysm in which the wall of an artery separates. It dissects longitudinally. Dissecting aneurysms tend to affect the thoracic aorta, but can affect the abdominal aorta also. Cardiomyopathy. Cardiomyopathy refers to diseases of the heart muscle. In most cases, cardiomyopathy causes the heart muscle to become enlarged, rigid, or thick. Pericardial tamponade. Cardiac tamponade, also known as pericardial tamponade, occurs when fluid in the pericardium, that's the sac around the heart, builds up, resulting in compression of the heart. Foreign body obstruction is another cause. Infections such as pneumonia or epiglottitis. Epiglottitis is a potentially life-threatening condition that occurs when the epiglottis, a small cartilage lid that covers your windpipe, swells, blocking the flow of air into your lungs. Pneumothorax. A pneumothorax is an abnormal collection of air in the pleural space between the lung and the chest. Symptoms typically include sudden onset of sharp, one-sided chest pain and shortness of breath. There are more causes, but we will not discuss them in this video. We will continue our discussion on the next video, picking up with the history that the physician will seek as part of your doctor's visit. Well, I hope this helps. Have a good day.